Okay, fantastic. Welcome, everyone. All right, so today, welcome, everyone. Thanks for joining the webinar. We know we have nursing leaders and HR leaders from across the country who've joined and spending some time today to kind of learn some strategies, learn some tactics and tips from our expert speakers. So today we're going to be discussing how UC Davis Health hires and retains permanent nurses. And my name is Iman Abuzeid. I'm an MD by background. I've been in healthcare technology for the last 10 years of my career. I'm the CEO and co-founder of Incredible Health. It's a hiring marketplace for hiring permanent healthcare workers. We happen to be the fastest growing career marketplace for healthcare workers and for nurses, specifically in the US today. On Incredible Health, we flip the script. Hospitals and health systems apply to nurses instead of the other way around. So joining us today is Etka Vyas. Etka is a Deputy Chief Human Resources Officer at UC Davis Health. Her background includes 25 years of leadership experience and progressive consulting in human resources. Etka joined UC Davis Health in May 2020 after 14 years with Stanford Healthcare and Stanford Children's Health. Most recently, she served as the Executive Director of Human Resources for Lucille Packard, Stanford Children's, before joining UC Davis. So we're thrilled to have you today, Etka. Thank you so much for joining us.
Thank you, Iman. Happy to be here.
All right. So what we're going to be doing today is we're going to be covering the state of the hiring market for nursing, permanent nursing in particular, and we'll be sharing some data on what's going on in the market today. And then we'll also be going into UC Davis's strategies for hiring and retaining nurses. On the hiring front, we'll be covering scheduling and shift preferences and flexibility, compensation and hiring process and speed. Then we'll switch over to the topic of retention and retaining permanent nurses, including strategies around career and educational opportunities, how UC Davis addresses burnout and fostering resilience, and how we create a culture of leadership, a culture and a leadership team that drives retention as well in nursing. All right, so let's go into the state of the market. Let's set the scene here and what's going on. I think Etka is living this day to day. I think everybody on this call is dealing with the challenges in the market today. So we are, as a country, our demand for healthcare keeps going up, right? Our population is aging. Certainly pandemics don't help. And so the demand for healthcare in this country keeps increasing, but the supply of workers has not kept up with the demand. That's particularly true for nursing. And healthcare is the biggest employment sector in the US, and 1 in 8 Americans is working in it. So by 2023, we are on track to be 1 million nurses short. We are missing 1 million nurses that we need to keep up with this demand. The annual acute care nurse turnover prior to the pandemic was at 18.5%. Now our most recent data shows that over the last 12 months, the national average for acute care nurse turnover has increased to 21%. And then in addition to that, the labor has become more expensive, right? So labor as a percentage of revenue has gone up to 48%. And that includes not just, the labor costs of our contract workers like travel nurses, but certainly the salaries of permanent workers and permanent nurses have also gone up very consistently over the last few years. And we're looking at an average days to fill now nationally, about 82 days when you do it the normal way for hiring permanent nurses. All right, and the pandemic has really just made a lot of these numbers worse, right? So we're all facing many of these challenges, and we're all, we're in this together, trying to manage this difficult situation. All right, so before we dive into the details of hiring, Etka, I'm just curious, just kind of overall, how has the pandemic affected nurse hiring at UC Davis?
So the stats that you share, definitely, it's evidence-based and prevalent in the industry. I would, in response to your question, I would say that during the pandemic, actually, quite contrary to the challenges that are prevalent in the industry, we did not do that bad. We actually did well from a recruitment retention perspective. Weren't very adversely affected by COVID. And you'll see as we go, forward in our conversation today, why we were able to do so. We were definitely challenged, like many other organizations, since people had an impact on their personal lives, right? COVID had an impact all across. And so the challenge from a nurse staffing perspective for us was more about how do you support your workforce with multiple leave options that they have, especially with UC being very generous about leave, and then the backfills that are needed. And of course, it was not anticipated. But the reason I'm saying, we weren't as challenged was because it did not impact the level of service we had to provide because our internal infrastructure, right, of internal migration, of the float pool, of, providing opportunities to nurses, our new grad nursing program, all of those components of the infrastructure that you should create for a solid nursing program, that actually fared very well in supporting us to go through the pandemic. The challenge actually with us was that our volumes grew, more opportunities opened up, like more OR openings, more clinic openings, and there was more expansion on top of, the already existing, programs that we had. So our challenge in hiring was more about, how do you backfill positions where internal migrations are happening? And now we're getting to a point where we're kind of recovering from managing all of that. I would say that the reason we stayed pretty stable was because of low turnover and vacancy rates. We did not see a big spike. We had like a little bit of a spike here and there because people chose to, they were close to retirement and they chose to retire. But again, our float pool and our new grad nursing program and all the infrastructure that we established, that actually came to our rescue. Going virtual, the virtual platforms and our outreach efforts and everything helped us a lot. So
okay, fantastic. So we know that nurse hiring and nurse retention is non-trivial. And so when you describe that it wasn't as bad, I mean, we know that was not by accident, that was an intentional set of strategies and tactics that your team has implemented to address that. And we're going to go into that detail, some of that detail today. Just quick note to the audience, we are recording this session. So this will be available to you afterwards as well. And then please there's going to be plenty of time at the end for Q&A. So feel free to send your questions through chat at any point, and we'll get to them towards the end as well. All right, so let's dive into like next level of detail, Ekta. So in general, when we're talking about the recruiting strategy and the general recruitment question for nurse hiring, what are some of the strategies that your team has implemented to successfully recruit nurses?
Yeah, sure. I would definitely want to say it's a collaboration. It's not just the talent team or the HR team. It's really, really a very close partnership with nursing leadership, specifically our Chief Nursing Officer, Toby Marsh. So there are a couple of things, that have really, really worked out very well for us. The first thing I would point out is our magnet designation. So our foundational strategy is definitely inclusive of multiple components, and we are pretty big. We're 16,000 employees, right? We're an integrated, health system, academic, medical. So a magnet designation, of course, contributes significantly to attracting nursing talent. And besides being a magnet organization, we have other accolades also, depending on the nursing specialty we are hiring for. And it definitely offers a great advantage to us in hiring. You have to market it properly, you have to advertise it properly, and kind of share it with your prospective talent. Now, I've alluded to our new grad nurse residency program, and that is one of the strongest foundational element we have when it comes to nurse recruitment, retention, as we hire about 150 new grads per year. Yep. And that's across 4 cohorts. And just this year, we've added a 5th cohort. So our residency program was just accredited by ANCC. And typically, we have outperformed in all the metrics nationally against other participating hospitals in the residency program. Now, it does help because it's not just that we are using the new grad nursing program to bring in new grads, but we are actually also aligning it to the growth and professional development of nurses, and how do we place them, right? And the opportunities we create for them in backfilling the roles that are getting vacated. So it's all like a machinery, like an integrated system. We're starting to do more new grads for ambulatory and home health. And, when it comes to inpatient areas, nothing's off the limit. It's an extremely successful program. Now, when it comes to hiring strategies, of course, your outreach efforts make a huge difference. And 2 of the vendors that we use, and I'm sure many folks in the audience are familiar with them, are the advertising firms called SmartPost and ad club, and the significance of that is, Smart Posts is a platform that allows recruiter to immediately post a position on website available on their list. So it offers more services as far as creating campaigns for hard to fill positions. We are an employer of choice where nurses can advance their careers. So projecting the professional development opportunities, the way we offer career advancement, all of that definitely helps a lot. What's interesting is at Stanford, we established a formal employee referral program and used to leverage that a lot, in hiring nurses. We don't have a formally established referral program, and yet I can tell you how many nurses we get just because of employee referrals. And that, talks to the culture that we have, and, how well placed and professionally growing our nursing population feels. And of course, diversity and outreach services makes a big difference. The whole concept of diversity, inclusion, and nursing is actually quite ahead on the curve when it comes to how they are working on creating a culture of inclusion. I'll wrap it up, Iman. You've talked about the strategies. I have to say that on top of everything that we do, there's Iman, right? There's Iman, and there's Incredible Health.
Incredible Health, yeah.
Yeah, and this is not a marketing pitch. This is definitely not a marketing pitch for you. I've appreciated your partnership all along from my Stanford days, and this is a wonderful strategic partnership.
Yeah, absolutely. UC Davis does hire a lot of permanent nurses from the Incredible Health platform, particularly those that are specialized and experienced. So according to our proprietary data, we have hundreds of thousands of nurses signing up on the marketplace, and tens of thousands per month. And so our data shows that there's a set of reasons why nurses change jobs, right? And it all like when you analyze all the data, it all comes down to usually a few things, right? It comes down to I need better work-life balance, or I need like just more balance in my life, so I need more flexibility, frankly, right? I'm looking to advance my career, I'm trying to reduce my commute time so I can spend more time with my kids, my family, so on. And then the fourth is I'm looking for more pay. I think many nursing and HR leaders assume pay is number one. Actually, our data shows it's number 4 on the list usually when it comes to the reasons why nurses are actively changing or are changing jobs. And so we know that a full-blown hiring strategy incorporates, addresses many of these topics. So let's dive one level deeper into shift availability and preference, right? So how does the UC Davis team address the need for flexible scheduling, especially during COVID and even prior to COVID?
So, when it comes to shift assignments, we definitely have CNA, represents our nurses, and a lot of this is also, how you go about building those things in the contract. But when it comes to assignments, they're primarily determined by seniority within the unit. So normally the shifts that are available in our postings are those where no internal interest within the unit has been received. Now, since you're tying it to flexibility, that's where, your creativity comes into play. And what we've done is we've allowed our nursing units to staff 20% of their staff at less than 90% FTE. So that's one of the ways, management offers some part-time shifts to nurses. Now, the primary workforce that has a preference for shift flexibility or shorter shifts, at least, in our experience here at UC Davis Health, those are our young generation NICU, PICU nurses with young families. I will say we do not necessarily claim to have the same level of shift and schedule flexibility that some community hospitals out there have, just because of the nature of the work we do. But we are actually benchmarking our practices right now with other organizations surrounding us. And then we're working that out with our nurse leaders to explore expanding more part-time positions so we could meet people, where they are in their life experiences. It's typically governed by life experiences, but I have to say that even if we've seen people making different employer choices due to shift or due to flexibility, it hasn't been that big on us. We've had very few instances where that has been a retention issue, and that's kind of directed us to look at expanding those options even further. I mean, you mentioned COVID, and one of the things that actually helped us during COVID was that where other hospitals did away with their clinical rotations, actually a lot of hospitals closed their rotation program. We did not do that. We kept going and we showed our commitment to the future of nursing. And the nurses, then the messages gives out to the nurses is that we're invested in them. And that's very big. We were very much appreciated for keeping our clinical rotations program open. So, even beyond the shifts, there are a lot of ways to keep your nurses engaged. They pretty much will look at the totality of the situation before making a career choice. Yep.
Okay, so one question from the audience that's relevant to this topic we're about to bring up is a question from Gary, and his question is, what was your strategy to keep RNs from leaving for travel assignments? And we're about to go into the topic of compensation in a moment. I wanted to kind of mention a few strategies that other teams we're working with have used, because it's been a very real problem, like losing nurses to travel agencies. So probably one of the most creative tactics we've heard is hospitals have created their own internal travel agencies, right? So they are essentially creating an internal pool of what they call, they call them travel nurses too. And what they're doing is that they're offering more compensation in exchange for flexibility, right? So you can join, this internal travel nurse pool, and you're still an employee of the system, but it means you have to be very flexible on your shifts. And you have to be very flexible on your location, particularly for those larger health systems. You have to be flexible to go to any location in any unit. So that's one creative tactic we've heard. Of course, we know that float pools are used as well to enable this flexibility. Curious, Ekta, if you had any more thoughts on this topic that you may not have to deal with it at UC Davis as much, but we know that many nursing and HR leaders are trying to tackle this travel agency challenge.
Iman, it's interesting that this has come up because, again, I'll say, maybe we are this one-off very solid standing, from nurse recruitment retention perspective, but we don't leverage travel nurses that much. Mm-hmm. We've not had to, and so we've not impacted either way. We were not impacted by the world, changing from the perspective of the staffing ratio of regular to mm-hmm. contingent nursing, and at the same time we weren't losing. Our retention rate didn't change. We stayed pretty stable between 4 to 6%. To the point you just made, of course, the clinical rotations program that I mentioned, the float pool that we have that allows people to actually go and, get the kind of, position that they want to get in, or kind of move in the organization. I mean, all those things exist, and they've existed before the pandemic. And the fact that overall, we've not seen a high turnover rate, right? Yep. And a shift in our staffing ratio between regular and travel nurses is just, a testament that our overall strategy for nurse recruitment retention that was in place prior to pandemic actually served us very well during the pandemic. So.
All right. So before we go deeper into compensation, we know that UC Davis is a public institution. I guess how does that impact how you think about nurse compensation?
So, as UC, I'd go back to being a UC. When we talk about compensation, it's more about total compensation package, right? UC is very well known for the rich benefits program it offers, right? Now, of course, you've brought up the question of being a public versus a private. And what I'm going to say is, nursing salaries are primarily driven by the nursing hiring plan, which is based on the relevant RN experience of the candidate. Now, regardless of being a public institution, the matter of the fact is that our salaries are driven by the negotiated process, and that's driven by the market we operate in, right? Yep. So there's a market for nurses out there, and that market sets the benchmark for what the union's going to put on the table, and what's going to be eventually negotiated. And the market has its rules. I'm using the words of our CNO. He typically says that market has its rule and you have to play by the rules, right? Yep. Whether you're public or private. So what we do is we highlight total compensation in our offers. Our salary offer for nursing positions is driven by the hiring plan that we have with the union. And while the salary is set, recruiters always refer to the total compensation on our offers by making sure that we highlight the benefits. Now, we also have longevity. I mean, our average years of service for nurses is like 20 years, and I'm saying average. So we have people who've been with the organization 30 years, 35 years, right? Very common to see that. And it's a combination of culture. It's a combination of the benefits package, the retirement. Retirement's huge for UC, right? The pension plan, huge for UC. Disability, life accident insurance, family care resources, a lot of those things. And, not implying that other organizations don't offer it. I think it's more about what are you highlighting to the candidates, from the perspective of total compensation. And, it doesn't put you behind in any way being a public institution, when your overall offering is so rich.
Got it. Okay. So you've worked at two premier institutions, right? Stanford
Yeah.
Children's and at UC Davis now. And what are the differences that you noticed or you observed between in when it comes to nurse salaries for recruitment and retention?
Well, interesting question. There are similarities and there are differences. I'll go back to the fact that there's a market for nursing. Yep. Right. There's a market for nursing, and especially when you talk about, positions where a lot of experience is needed and you're playing in the national market, right? I mean, the whole, public versus private, or whether you're represented by CNA and, whether you have a homegrown union like we had at Stanford, typically those boundaries start blurring, right? So from that perspective, both institutions, both Stanford and UC Davis Health, have similar market we are playing in. Now, from a branding perspective also, it's similar because they're academic medical institutions, magnet designated hospitals, and there's always a certain expectation that the talent pool is going to have, right, when they are considering you. So overall recruitment retention is driven by more than just salary. Now, when you talk about differences are primarily driven by the geo market, right? So Stanford, Bay Area, definitely drives higher salaries versus Sacramento. One of the biggest problems that I had at Stanford was when we were relocating nurses, right? You're hiring them and you're relocating them, and there's a fear. There's a big fear, and I found out there, it was quite interesting that there are some, geo differential and market cost of living calculators that people use, and as questions,
sticker shock from
why are they out there on the internet, and who's validated them, right? As being on the employer side, you're like, don't go by that, they're not giving you the right numbers. But the matter of the fact is they're out there. People use them, to see, okay, if this is my package, and even including benefits, rich benefits and everything, based on the cost of living, what's the overall deal. So I dealt with that. My team, we hiring managers at Stanford dealt with that a lot there. Versus Sacramento is more reasonable. Not that it's not growing, but still compared to the Bay Area. Now, the other difference between hiring for Stanford and hiring here is also the range of the specialties. At Stanford, it's primarily acute care. So most of the specialties you're hiring for, are mostly in the acute care area, and that has its own challenges, right? Mm-hmm. Here, there's a full range. UC Davis Health, it's a full range of acute care, home health, primary care. So the options for recruiting and retaining, right, they're broader. And then the internal migration and professional learning across different functions, they're more than they were at Stanford. So that definitely helps because, it's your selling pitch, it's your marketing, it's not just, okay, we're welcoming you to an institution, but how are we going to support you? How are we going to help you with career growth and all of that? So, that's basically what I'm seeing, it's the same market, the rules are the same. The nuances, the differences are primarily the geographic location, plus, the variation in the kind of services we offer.
Got it. All right. So let's dive into hiring processes, which is another critical topic when it comes to nurse hiring in a competitive market. So I want to just do a quick exercise with the audience, and we're sharing some data right here. This is actually real data from the Incredible Health platform. It happens to be from our LA market. We work with a lot of employers in the LA market. And, we've anonymized them, of course. So we have competitor A here that has the highest salaries in the market. We have competitor B that has the biggest brand in the market. And then we have competitor C that has the fastest speed. We're talking about hiring speed from the time they send an interview request on the Incredible Health platform to the time an offer is accepted. They've gone through all the steps. And you can see here, the number of days or the amount of time candidates are spending in each step of the process, really stark differences, especially when it gets towards the end, around how long it's taking hiring manager interviews to be completed and how long it's taking to extend the job offer. And so as we're looking at these, so as you're looking at this data, this is a question to the audience, who do you think A, B, or C hires the most in a given period, in a given month, say? Is it the team with the highest salaries, which is A? Is it the team with the biggest brand in the market? Or is it C, the team with the fastest speed? Feel free to put your answers in the chat. All right. Give everyone 30 more seconds. Yep. So I think majority of you got it right. It's C. The team with the fastest speed hires the most. This is not the team that has the biggest brand in the market. They're not even, I think they're at the 50th percentile for compensation, not any more than that. And they do hire the most. That was actually something that surprised us, frankly, when we first started Incredible Health back in 2018. We always assumed, oh, it was going to be the teams with the biggest brand and the highest salaries that we're going to hire the most. No, it turns out that your internal hiring operational processes are the biggest factor in terms of driving hires for your team. Data we have from our platform as well is 68% of nurses accept the very first offer they receive. And 61% of nurses accept the very first offer they receive, even if the second or third offer has higher compensation. This is happening for several reasons. Usually, 99% of the time, when you are looking for a job as a nurse, you're already working. I mean, you're working a lot, in fact, right? So you really appreciate the speed and acceleration and fantastic candidate experience that a new employer can give you. It also reflects very well on the health system. I think we always say HR is the front door to the employer. And so if they're having a great time and they understand what's going on in their process and they're moving through quickly, that reflects very positively on the rest of the health system as well. All right, so we do have a partnership with UC Davis. We also have one with Stanford Children's as well. And what we wanted to go into next is go a little bit deeper into this hiring process and operations. So this is a quick overview slide of how we collaborate. So this is the 8 steps in the hiring process. Incredible Health, our software, our technology, our marketplace is taking care of the first 4. Finding the nurses, pre-qualifying them, making sure they're actively looking and getting that first recruiter phone screen scheduled. At that point, the UC Davis team is taking over. They're completing that phone screen. They're getting the hiring manager interviews scheduled, sending the offers and getting the offers accepted. So this is a true collaboration, a true partnership. This is where talent acquisition is going from a strategy and future standpoint, in that it's many talent acquisition leaders, HR leaders, and nursing leaders that we're working with are trying to automate, frankly, things that are lower skill, right? Things that can be done with automation, like sourcing, like screening. That can really be, you can really leverage technology there, and that ends up freeing recruiter time and hiring manager time to focus on what they do best, which is interacting with the candidates directly. And so that's how many leaders are thinking about this today. Curious, Ekta, when you think about speed at UC Davis, I know that you've done a lot of work in this area as well. How do you think about how UC Davis drives faster hiring and faster time to offer as well?
It really, it goes back to the partnership you have with the business leaders, with the hiring managers. Yep. Of course, there's definitely an accountability on the part of the talent team in screening and forwarding the candidates. And you really need to know, first of all, do you have the bench strength and the right skill set for your talent team to really know the specific areas that they're hiring for, right? Because otherwise, screening for the right, especially when you're in acute care, screening for the right competencies and knowing all of that and forwarding the right candidates, it can be slowed down right at the onset, if you don't have the right nurse recruiters who understand that area well. So you have to start with placing the right people in your nurse recruitment team and staffing it well. But beyond that, the speed is all contingent on the collaboration and the process, streamlining of the process that you established from talent through the hiring managers team, right? What we actually do is, you've partnered with us on the OR, the recent OR peri-op recruitments, Iman, and you've seen that, we have this regular check-in and we have a timeline set, for like, okay, if this is the start date when you need somebody and, hit the ground running, how do you work backwards and make sure that you have developed a timeline by when, you're ready to make an offer. And that kind of determines the cycle time you can afford, right? You really have to be very realistic about how quickly you have to interview, how quickly you have to screen, how quickly you have to, keep moving candidates forward. And one of the things that I believe I've learned, from leveraging Incredible Health from my Stanford days was knowing how quickly your industry competition is offering jobs, right? You could have the same candidate be applying to 3 different hospitals, and if you're slowed down, you lose the candidate if you're delayed in offering. So it really depends. It depends on how much time you have internally from a business perspective. If it's opening a new area, and you've planned your strategy very well and you've built in the cycle times very well, of course you can give some breathing room to hiring managers. If not, this is what they're doing, right? They're carving out that time, and it's very much needed. So if that answers your question, it's really not like a one magic number. Screen the candidate as soon as it's received. It depends on project to project, but on an average, we do set accountability on our team, how soon they have to screen and forward the candidates, not sit on edge, and how soon the hiring managers have to review and get back to the candidates, and make sure accountability is on both ends, not just the recruiters.
Yeah, absolutely. Okay, so just to summarize, so it needs to be first of all, hiring is an executive priority. So we know the HR leaders and the nursing leaders care about it, and they collaborate closely on it through check-ins, it's important for the recruiters to understand what the hiring managers are looking for, and it's important for the hiring managers to understand what's going on in the market too. And it sounds like you're also, there's a lot of tracking going on, data tracking of how quickly our candidates moving through the process. And we provide, the benchmark data as well, like, because since we are working with pretty much all the competitors in the market, we're often able to provide that anonymously, how other teams are moving. And then it sounds like you have service level agreements almost to the point between recruiters and hiring managers in terms of how quickly they need to get back, how quickly they need to make decisions, how quickly hiring manager interviews need to be scheduled. And we know that your team, as well as other teams, have implemented a range of tactics there, right, around ensuring hiring managers have blocked time to actually do interviews.
We have panel interviews actually, and we have HR business partners assigned. Yep. Most of the internal hospital operations areas have HR business partners who will provide oversight and coordinate all of this, and block times for panel interviews, and like interviewing all day. They're all days, an entire day would be blocked for hiring managers to come together as a panel. Yeah.
We know that your team is also standardized and streamlined the number of interviews required to make a decision as well. And so you kind of standardize that across many units. We also know that your recruiters have some flexibility to even schedule that hiring manager interview before the application is fully, completed, right? Like they're parallel processing, getting the candidate to apply officially, and saying like, hey, we can get this hiring manager interview scheduled if, as soon as this is done. And so that's all been, led to lots of success in nurse hiring for UC Davis.
Well, it has, and the feedback, I would emphasize that the feedback and understanding your benchmarks, right? Especially when you've lost somebody because you are not as fast, right? Mm-hmm. In proceeding with an offer. It's very, very important to understand that feedback and, what kind of talent you're losing if you're not moving fast enough. And we share that with the hiring managers. So there's full transparency. I think the transparency of dialogue, understanding how things are going, and, if they are not doing their part. And the same, we are very open to feedback from hiring managers when things are not working for them.
Yep. All right. So, all right, going on to the couple quick things just about the overview of Incredible Health. Mentioning this just because Ekta's had extensive experience with us, both at 2 systems now. Hospitals, they use our custom matching technology to hire high quality permanent nurses in less than 20 days. The unique thing about the Incredible Health marketplace is that the employers are applying to the talent instead of waiting for the talent to come to them. As you can imagine, the nurses absolutely love that. It's a very strong candidate experience because, you know, they're getting, and if you're a nurse on the platform, you're getting interview requests from multiple teams, let's say from the Stanford team or the UC Davis team, and the nurse gets to choose which interviews to accept or decline. We've also automated the screening and the pre-vetting of the talent as well. So we're only serving up high quality talent in front of the employers. And then I think that's the thing that both teams love is a custom matching. So it's not helpful for a UC Davis recruiter to log in and see 200 nurses. They need to see like 14 that are the exact right fit for UC Davis at that time for the specialties that they are looking for, with all the requirements that they have. And so the custom matching algorithms happen to be our claim to fame as well. Quick case study. This is not UC Davis's data. It's another team in California though. But your team's data looks very similar now. So without Incredible Health, days to fill was consistently over 60 days. With it, it's consistently under 30 days, which is what we try to achieve for every single team that we work with. And really the biggest impact is on the time to source, really getting that down from 44 days down to 3 days. And because it's for specialized nurses in particular, it's hard to just even find them in the first place. And certainly we talked about like shaving off a few days later with automated interview scheduling and things like that and other process improvements, but really the biggest impact is on time to source. We're working with over 500 hospitals and health systems across the country, including big ones like Kaiser Permanente and HCA and Baylor Scott and White. We work with many academic medical centers like Stanford and Cedars-Sinai and Johns Hopkins and UC Davis, and lots of community hospitals across the country too. All right, so let's dive into the topic of retention, because I know many people joined this call to hear more about your nurse retention strategies, Ekta. So, I mean, we know that there's a whole range of tactics. Curious to hear how UC Davis specifically supports career advancement, because we know that's a critical key to you retaining your nurses and having that amazing, only 4 to 6% turnover rate.
Yeah. No, yes, this is our biggest competitive advantage, actually. So our career profession, I would say our career progression and professional development is one of our biggest strengths when it comes to nursing. I've already talked about our nurse residency program when I was at Stanford, and this is no way to compare and contrast for good or bad, but there, we were like adding the second cohort in one single year was a lot of conversation. Here we already have 4 and we've added 1 more, right, for December. That says a lot. Now, some of the programs from a career perspective that we have include definitely our career ladder program. It's one way for clinical nurses to advance their career through validation of professional development, leadership, and education. Another program we have is Rising Nurse Leaders Program. It's a 2-year part-time program, and it's designed to provide aspiring and current frontline administrative nurses with opportunities to acquire essential, KSAs, knowledge, skills, abilities for ongoing leadership and professional development. Now, the ultimate program goal is for the participants to become effective administrative leaders and shape the future of nursing at UC Davis Health. One of the other programs that's really popular here is Bridges to Excellence, and that enables a nurse to learn about a discipline, unit, a care area, or process different from their current work environment while they're earning continuing education units, the CEUs. And it's a great program. It's very, very much appreciated since it allows the staff to use their professional leave actually to go and explore another part of the organization. So they can go on that leave and explore another part of nursing, where they're delivering clinical care, or maybe it's research, right? Or maybe it's a procedural area. And, they can go and kind of reverse interview. So these 3 are the big highlights. We have a lot of leadership development programs, our overall, professional development programs that come from our learning and development team and have been established even outside of the learning and development team, standalone programs that we offer. It's actually very rich, and that's one of our biggest retention factors, actually.
Okay, that's fantastic. Yeah, absolutely. I mean, the teams that are investing heavily in career advancement opportunities, whether it be cross-training, leadership training, love the innovative ideas you just mentioned around allowing them to take leave and go to a completely different part of nursing. That's really cool. And we know that you've heavily invested in new grad programs as well and rotational programs. Yeah. On the topic of burnout and resilience, how's your team thinking about that? That's like something that many of us are struggling with. How are you addressing nurse burnout and fostering resilience?
Now burnout and resilience has gone beyond nursing, right? Especially in healthcare during the pandemic. It's like organization wide. I'm not undermining nurse burnout, definitely very significant, but what I'm trying to say is that now we've had to think holistically about the entire organization, beyond nursing as well, for employee well-being and employee health, and how do you support them? Pandemic just like opened our eyes to a very different reality, right? So when you talk about burnout, specifically to nursing, it's a reality in clinical work with or without a pandemic. So it's not like, yes, the pandemic added more stress. But for the nursing world, right, burnout was still there, right? Resilience was still needed just because of the nature of the work that they do. So support to prevent that burnout has primarily had to be built into our culture. Yes, we did make specific efforts during COVID, like we had a resilience series. But again, keep in mind, all of these workshops and these training programs, when it comes to those who are on the front line, right, delivering patient care, again, they don't have the time to go and attend workshops and, attend these training programs that probably others can leverage. So you have to build it into the culture. And that's what actually helped us survive. We have a heavy emphasis on relationship-based culture. If anybody from the audience wants to go to our website and look at, what we do in the nursing area, one of the big things that's going to stand out for you is relationship-based culture. And it's foundational to providing support to our nurses and clinicians. And beyond that, there are a few offerings. We offer nurses the opportunity to retreat with other nurses, reflect and build tools to help them in caring for patients who are ill and sick, and especially, where it weighs heavy on them with moral distress, etc. Another program is called Support You. So Support You is a program that helps clinicians with challenging situations, issues or dilemmas or moral distress. Maybe it's death at the bedside, or just different outcomes than they thought that they'd be able to deliver in a particular care management issue. It's kind of related to care of colleague. And then, as I said, it's more part of how you've developed your culture. We promote self-care. I mean, within our nursing area specifically, there's a lot of emphasis on self-care and helping people to live fit, mindfulness. We have a department called Academic and Staff Assistance Program that's staffed by clinical psychologists. So you can go for confidential counseling services. Now, we have to keep in mind we're a big organization, right? And just because you start in one area, that doesn't mean you have to be a certain type of nurse always. So that has actually really, really helped us, because that gives us this flexibility to offer opportunities to nurses to explore their passion and grow when they're feeling lack of growth, or when they're feeling like heavily burnt out in an area and they have to kind of transition to another area. So it's really a holistic approach to how you're creating the culture, the environment, beyond just, are you creating workshops for resilience, all of that, the counseling, the peer-to-peer support, management roundings, and I'll say recognition is a big deal. I mean, if you follow UC Davis Health, on LinkedIn or social media, you'll see how much of recognition and thank yous there are from our leaders there. And during the pandemic, it really, really helps. That whole recognition for what they were doing and constant recognition day in and day out. It helps. It's a psychological de-stressor, when you feel that your efforts not going unseen.
Yeah, really important topic, very, very challenging one to deal with. On the topic of leadership, like, look, there's this cliche that people, employees quit their managers, and that's true across all industries. And we know that your team has invested heavily in people managers and nurse managers as well. Curious, how does UC Davis Health help people managers lead successful teams?
So I'm going to take a little bit of a different perspective on this, and of course, not undermining the significance of managers leading successful team and investing in leadership development, investing in managers. But what I'm going to say is that successful teams are a result of many factors beyond just people managers. So that brings us back to my emphasis on the culture. right? Successful teams are also a result of what's the relationship between colleagues, not just, how managers, and of course, managers have an accountability of how you're managing that interpersonal dynamics, right? So one key component of being a magnet organization, again, to be a magnet organization and to maintain that status means that nurses are participating in decision-making that affects the care, the structures, the processes, the policies in delivering care, whether it's formulating a policy or determining the process or how we're addressing a clinical care issue, right? And I think that empowerment, and the nurses, are providing their feedback, influencing the care outcome. So that empowerment, there's a lot of empowerment, feeling like you have a say in what you're doing, and empowering the nurses to be on different task force. All of those things actually lead to successful teams. I mean, everything, all of those things matter. And definitely to bring all of that together and maintain that cultural component is primarily on people managers and leaders. And our nursing leaders are doing a heck of a job with that component, which is reflective in our low retention rates, right? Now, yeah. I did mention that turnover rate has been historically low for some time, and it's stayed stable, stayed really low, while in different parts of the country, turnover is going double digits, right? We're even seeing that in California. You shared some stats at the beginning. Yeah. And it's kind of daunting, and it's a little scary. But going back to a relationship-based culture, effective teams, successful teams, it's an infrastructure of just culture, psychological safety, the things we've built in through our rounding and huddling processes, allowing our staff to escalate issues so we can fix them in real time and be responsive to the clinician's need at the time point of care. So, and the culture of recognition, definitely very, very, very significant. So when I was talking to our CNO a couple of days back on the cultural component, and he was talking to me about the relationship-based culture, and one of the things he ended up saying was, they're focused on removing every pebble in the shoe that's possibly known to us. And that's a very powerful statement coming from a CNO, right? Because that shows your commitment, that we are focused on removing every pebble in the shoe that's possible. So we know that a lot of disruptions that many healthcare organizations, many hospitals were facing during COVID, like pharmacy disruptions, supply chain disruptions, our huddling process resulted in no errors, when these disruptions were happening. And, our teams were so nimble in identifying issues and responding to them, fixing them in real time. That's what makes successful teams. So it's a collaborative effort, it's a joint effort. And of course, leadership development and, how mature your managers are definitely makes a difference. But again, if you look at, how a magnet organization should function, you want to see the full empowerment coming like full cycle along with leadership and managers.
All right, thank you. So let's go into the Q&A section. We got quite a few questions from the audience. Here's one question. Actually, there's a specific question around Incredible Health, around your decision to use it, and also did it help reduce your recruitment FTEs? I mean, I can answer part of that last piece, and it's not about reducing recruitment FTEs, it's about changing what your recruiters do. But please, if you can comment a little bit more on that, Ekta.
Well, so my experience with Incredible Health, wow, Iman, you really want me to go there?
I mean, that's a question from the audience.
Well, it's been fantastic. It's been different compared to, how I partnered with Iman and her team at Stanford versus UC Davis Health. Part of the difference is, and I'll just say it out loud. Incredible Health, when they launched their platform initially, when Iman and her team were very new in the industry, and Iman gives me credit for that. I was one of the first
early adopter.
early adopter, because I saw the model, I saw the platform, and I believed in the model, and I believe that they're going to be successful. It was very unique at that time. For having, nurses being registered on the platform and having a choice to apply simultaneously at different hospitals. But the reason, I was an early adopter was because it was giving me at that point in time something that I was missing from an industry benchmark perspective in real time. Right. Most of the benchmark data that you get is dated. It's always dated if you're relying on surveys, right? You're relying on surveys, or if you're launching a survey, which my team's used to at Stanford. We had like a very specific custom survey that a third-party vendor was launching for us, and we were trying to get time to fill and different acute specialties and, you know, the staffing ratios and all of that. But again, by the time you get it, it's dated. And one of the things that the Incredible Health platform brought to my, you know, my recruitment team there was, you're going to be able to see in real time how long you're taking to interview compared to the competition in the industry, how long you're taking to make an offer compared to others. Did you really lose somebody who you were so heavily wanting to get on board because you were 2 days behind, you know, your competition? So that actually is very powerful. That's very, very powerful. And it worked well. I mean, as an early adopter, I can, you know, I'm sitting here talking about it today and, you know, seeing all the success that Incredible Health has seen. At UC Davis Health, you know, definitely it's much larger organization. We continue to, Incredible Health was already partnering with UC Davis Health. I joined in May 22. I did not have to bring them here. They're very well known in the industry. It was good to see that there's already an existing partnership. And more recently, you know, we've partnered with them more on our peri-op OR expansion. And again, you know, there's some key elements that I've mentioned in regards to, you know, keeping yourself updated, which really helps. And you struggle with that, you know, for other platforms that you use, or if you're doing your own stats, right? That's a challenge. So I'd say, you know, in a nutshell, I really, really appreciate the model. I appreciate the platform. And then I appreciate the partnership, you know, the partnership of having constant updates on how many, I think you sent to us how many interview invites have been sent, how many have been accepted, how many have been scheduled, and you get all of that in real time, which is very helpful. It, you know, going back to the point you made, it's really not bringing down the FTEs, but just shifting the work that they do. And it allows you to kind of free them up from doing that mundane, you know, process-oriented thing that an AI, I think you use AI, Iman, for your, you know, platform that, you know, AI can do for you. Then you can have your recruiters be spending more time with the hiring managers on strategically, you know, coming up with a staffing plan.
Absolutely. All right. Thank you for that, Ekta. Another question. Do you find that unions have created some barriers with speed of hiring? No, right? I have a quick thought on that. We work with union and non-union hospitals. We even work with health systems that have both, like they have both types of facilities, union facilities and non-union facilities. It doesn't impact speed of hiring. I think the biggest impact is on the offer stage, right? Like the flexibility around salaries and things like that. Would you agree, Ekta?
Yeah, no, I absolutely agree. And I don't have to spend too much time on this question because you've answered it. It's really on the speed of the offer, and, you know, whether you can offer sign-on bonuses or you cannot offer if it's not built into the contract. How can you be creative outside of, you know, well, how are you going to attract them, right? So like I said, we leverage our total compensation package. We leverage the career opportunities, the professional growth, the internal migration, the longevity, right? So that at the point where, you know, if your union contracts are limiting you from making signing offers, I mean, they see much richer program than a couple of $1,000s at the onset of, you know, employment with an organization. But I don't think union having represented the population impacts your speed in any way.
All right. Another question that's coming, you know, we know speed is important in the process. I'm curious, this is from Tammy. I'm curious about the volume of recs that the TA team has and the ideal rec load to maintain that focus and speed, right? I mean, I'll comment on this just marketplace-wide, platform-wide, and then I'd love to hear Ekta's perspective. Look, we see when it comes to nurse recruiters, we see a range of rec loads. It can be as low as, you know, 70. It can be as high as 120 or 120. We've even seen 150 in some places, rec loads per recruiter. Now, the factors to consider is, number one, not all recs are created equal, right? So a whole set of recs for new grad nurses or for med-surg nurses is a different amount of work than to have a bunch of recs for OR, ED, labor and delivery, which we know that many of your nurse recruiters are hiring for highly specialized roles. And so those are more of the considerations than an arbitrary number of, hey, what's the ideal rec load? Of course, lower is often better because that means that recruiter can process more. But love to hear your perspective on this, Ekta.
I really don't have much more to add than what you've said, Iman. I've seen the same in my experience at Stanford and here. It can vary. It can vary. I mean, it was interesting you said as low as 70, 75, because in many organizations, 70, 75 is considerably large, right?
Yeah, for nursing specifically.
Yeah, typically what you'd consider low is 35 to 50 is like, okay, doable, at the most a stretch to the 50, right? It's, it begs a little bit of a thought when we start saying, 75 to 80 is considered low.
These days, the last 18 months, definitely.
Yeah. But, again, it depends on where's volume hiring? You could have, it's not the number of recs. Like if you have like 10 positions in the same area requiring the same skill set, it's really more about your sourcing and your outreach and how rich or how you can expand your talent pool. Because, in the end, if you have built a talent pool, let's say with 50 applications or 60 applications, and I'm not talking about acute care, it's highly experienced, you're not going to be able to get 50 or 60, in a short period of time. But, for positions where, 30 days is your normal cycle and there's not much challenge getting applicants and you have 10 positions, that's good. It's a 1-to-5 ratio, right? And then it's really more about how you're strategizing in going about your pipeline and your funnel. So that's how I look at it. Not just necessarily from a rec load perspective.
Right. All right, we've got a quick question. Just this one's incredible health related. Do you work with private ambulatory companies or just hospitals and medical facilities? I mean, today we're working with hospitals and health systems only, not private ambulatory companies yet, but we'll get there eventually. But we're staying focused at the moment. And then this is a question that came up regarding Magnet. Magnet is usually there's no Magnet representatives on the call. Like it's a great designation. However, it can limit nurse hiring, right? Because it has requirements around minimum education levels for BSN and things like that. So I'm curious how you think about Magnet you've definitely explained the positives of it, but curious if there are any downsides with being Magnet designated.
Well, if you're asking about my philosophical point of view, right?
Yes,
I would say I don't see downsides, because anytime you're trying to achieve for the greatest and the high bar, right, to take your organization there, you basically what you're doing is you're elevating the level of your expertise and where your organization functions, right? So even if it's arduous work, right, if it means that the minimum qualification for your nursing population has to be a BSN, right? Think about what kind of workforce you're creating and what kind of workforce you're generating. Now, when I was at Stanford, we had something built into, a little bit of an exception to be made to substitute for years of experience, for BSN and what that would be. And we had an established process on, that exception has to go through the CNO. And of course, in the contract, we had built in minimal number of staffing ratio at the BSN level. So it was very minimal, a small pocket of, window of opportunity where you could hire highly experienced nurses and you would have a waiver, right? You can establish some of those things. I don't know, at UC Davis Health, I've been here for 1 year. Now, I haven't gone into that detail of looking at if we have exception process or not. But what I'm trying to say is, I don't see downside. That doesn't mean any other leader in the industry wouldn't see a downside. And the reason I don't see the downside is because it just elevates the level where your nursing, population or your nursing employees are functioning at. It's a retention strategy. It's a recruitment strategy. It enriches your culture. It enriches your patient care, right? Your patient outcomes, everything. So if you look at all of that, why not? Right? It's be a learning organization and just, elevate yourself to a level where, you're considered to be a place where nurses would want to come and work for and stay.
Yep. All right. Absolutely. So this is being recorded and we'll be sharing it with all the attendees and registrants as well. If there are any additional questions, I know we're at time, please feel free to email us. I put the emails up on the screen, questions@incrediblehealth.com, and we'll try to get your questions answered as well. Ekta, I just wanted to thank you so much for joining us and for sharing your strategies, your tactics. Hopefully everyone who joined took at least a couple ideas away that they're going to go implement and discuss with their teams as well. And really appreciate your time.
I appreciate being here, Iman. Thanks for inviting me to join.
All right. And thank you everyone for joining. Appreciate your time as well. And we will be in touch with the recording and other materials.